Hello, I'm Dr. Russell Barkley. I'm a clinical professor of psychiatry at the Medical University of South Carolina in Charleston, South Carolina. Welcome to this internet course on ADHD in adults. This is part 2 of a 3-part program on adults with ADHD. In this part, we will be exploring the impairments that adult ADHD creates in many domains of major life activities. Part 1 of this course deals with the nature and diagnosis of adult ADHD, and Part 3 deals with the assessment and treatment of ADHD in adults. This course, Part 2, focuses on impairment. Before I begin, let me disclose to you my financial sources of support for the previous year so that you can evaluate the possibility of any potential conflicts of interest that might exist with the contents of this program. I'm retired from the University of Massachusetts Medical School, where I spent 18 years as a professor of psychiatry and neurology and director of psychology in the Department of Psychiatry. I receive a retirement pension from that medical school, although clearly I'm not retired. I continue to teach actively internationally, and you can see here the places I have spoken for and the funding that I have received from various associations for my presentations. I've also created a number of products related to ADHD in the marketplace, such as books, videos, a newsletter, and continuing education courses such as this one, for which I receive royalties. I have also been paid as a speaker for, and served as a consultant to, a number of major pharmaceutical companies that have ADHD medications in the marketplace. I also worked as an expert witness last year for the Eli Lilly company in a patent dispute. Let's begin our course. As I've said, this is part 2 of a 3-part course on ADHD in adults. In this part, I will be discussing the impairments in major life activities associated with adult ADHD. For more information on these impairments, as well as on other aspects of adult and child ADHD, please see the sources listed at the bottom of this slide. In particular, my book with Kevin Murphy and Mary Ellen Fisher, published in 2008, ADHD in Adults, What the Science Says. This is a comprehensive review of everything that is known about impairments associated with adult ADHD, as well as about symptoms and other criteria that might be essential for improving the diagnosis of the disorder. The adaptive impairments associated with adult ADHD can be summarized in the following diagram. ADHD in adults is often associated with very limited educational success. Both children and adults with ADHD are found to have difficulties in the educational setting, and this frequently leads to their receiving fewer years of education and having more difficulties in the educational system. And this problem with education continues into the adult years, even with adult educational activities. As with ADHD children, adults with ADHD have significant social relationship problems. This extends to their immediate families as well as their cohabiting relationships. We also find ADHD associated with a higher risk for antisocial activities of all stripes. This leads to an increased risk for arrest and incarceration in adults with ADHD. So often expect to see adults with ADHD having a history of legal difficulties. Adolescents with ADHD are often more prone to nicotine use, alcohol use, and use of marijuana, and these risks continue into the adult years. Some individuals with ADHD also report excessive reliance on caffeine. And if the adult with ADHD has had a history of conduct disorder or antisocial personality, then we see an increase in other substance use disorders as well. Several studies indicate that adolescent and young adult ADHD is associated with a pattern of risky sexual behavior, earlier onset of sexual intercourse, more frequent partners, shorter relationships with these partners, and less use of contraception, leading to a greater likelihood of teenage pregnancy and early parenthood. We also find that driving problems are significantly associated with ADHD in adults, leading to increased problems with speeding citations, as well as a greater frequency of crashes and more injuries in those crashes. Occupational problems are universal in adults with ADHD, just as are the educational difficulties. Indeed, if one had to rank order the areas of impairment most likely to be associated with the disorder, they would be the educational domain, social relationships, and occupational functioning. Adults with ADHD report significant financial problems with which they are going to require assistance and often have lower credit scores than do other individuals. And finally, our research on ADHD adults has found a pattern of unhealthy lifestyle. Individuals with ADHD are less concerned about exercise, self-improvement, nutrition, and other areas of maintaining a healthy lifestyle, and therefore may be at greater risk for medical disorders associated with this unhealthy lifestyle. Now let's take a look at each of these areas of functioning in more detail to learn more about these risks. Before I begin, I want to explain to you one of the studies on which this presentation is based, because I'll be showing a number of graphs in this presentation that are drawn from this study, and it will help you to have some idea about the methodology used in this study. This is known as the University of Massachusetts Medical School Study, or UMASS study for short. It is one of the largest studies of adults with ADHD referred to clinics. This study used 146 adults referred to an adult ADHD clinic and receiving a formal diagnosis of the disorder. We also had 97 adults who were referred to the same clinic believing that they had ADHD, but who did not receive a subsequent diagnosis of the disorder. Many of these individuals experienced anxiety disorders, depression, substance use disorders, relationship problems, learning disabilities, and so forth. They make an excellent control group because there is no referral bias difference between them and the adults with ADHD, as all were referred to and seen at the same adult ADHD clinic. Finally, we recruited a control group from the community of 109 adults of similar age and socioeconomic status. In general, the mean ages of these groups range between 32 and 38. However, within each group, the age ranges are from 18 years of age up to 60 or more years of age. The sample is predominantly a white sample with a slightly higher than normal IQ and with slightly higher than typical education. ADHD was diagnosed according to formal DSM-IV criteria using a structured clinical interview given by an expert clinician. The only exception to these criteria was that we waived the age of onset because we were studying age of onset as one of the dependent variables in this study. 76% of the individuals in the ADHD group were diagnosed with the combined type, 20% had the inattentive type, and 4% were diagnosed as having residual ADHD. One of the first pieces of data that we collected in this study had to do with the self-reports of impairment in various major life activities. Now, I can't graph all of the activities that we interviewed our patients about, but this is a rough idea of the self-ratings that were given in some of these areas of impairment. Here you see in the black bar the adults with ADHD, the white bar is the clinical control group, and the third bar in each graph with the denser pixels is the community control group. As you can see here, the clinical groups reported significantly more impairment in work, home life, social relationships, community activities, education, dating and marriage, as well as across all domains on the rating scale. We also found that adults with ADHD reported significantly more impairment than the other groups in the area of work, social relationships, and in education particularly, as I've said before. We had our adults with ADHD and our control adults fill out rating scales with regard to their impairments that they thought they experienced during their childhood years. And this reflects the percentage of individuals reporting themselves impaired in these various domains. As you can see here, education is the area most impaired in the most individuals. At least 90% of adults with ADHD reported that they felt they had been impaired in their educational histories. We can also see that many of them reported difficulties in accomplishing daily chores and responsibilities. And certainly adults with ADHD were significantly more impaired than the other two groups in home life, social functioning, community activities, and even in sports performance and self-care. Although the clinical control group was also impaired, it did not report being impaired as often, that is, in as many individuals in the group, as was the percentage of ADHD adults who reported being impaired in these various domains. So obviously, adult ADHD is a quite impairing disorder, whether we look at current domains of impairment or at retrospectively recalled functioning in areas of childhood impairments. Let's take a look specifically at the educational history of these adults. This study found that more adults with ADHD reported having been retained in grade than either of the control groups. Also, many more adults had received special educational services, nearly a third of them. And over 1/4 of the ADHD adults reported having been diagnosed formally as having a learning disability during their educational career. And as you can see here, almost half of them, about 40% in fact, reported that they had been diagnosed with a behavioral disorder in school. While the clinical control group also had higher amounts of these latter two categories compared to our community group, clearly you see here that adults with ADHD report significantly more difficulties in their educational histories with regard to these types of outcomes than do adults in either of these groups. As I said earlier, adult ADHD is associated most often with impairment in the educational domain. Now let's take a look at some of the work and school concerns that were expressed by our adults when we interviewed them in this study. Note that the inattention symptoms were much more likely to be impairing of these adults than were the hyperactive symptoms, which had declined markedly by the time they had reached adulthood. As I said in part 1 of this course on adult ADHD, hyperactive symptoms decline so much with age that by adulthood they are not of any diagnostic significance, and so it's no surprise that these adults were not describing any particular difficulties in the area of activity level. They often report feeling a subjective sense of restlessness or an internal form of restlessness, or restless ideas, or they feel a need to be busy and engaged in multiple activities simultaneously. Nevertheless, outwardly, they are not necessarily more hyperactive than other adults. But they do also report significant problems with impulsiveness, as we will see later. Often adults report that they have considerable difficulty sustaining their attention to paperwork or other boring activities, whether this is in the workplace, in school settings, or in their home life. They also have problems staying alert and staying focused, particularly in meetings with others. Self-organization is a major problem for adults with ADHD, as we will see later. They often describe themselves as having difficulties organizing their materials, having the materials they need when a deadline approaches, remembering where they have placed materials that they may need later on, and so forth. They have considerable difficulties as well with planning for the future, with considering multiple possible ways of attaining a goal, and if they encounter an obstacle on the way to that goal, they report having significantly more difficulties problem-solving their way around that obstacle so as to attain that goal. Procrastination is a major complaint of adults with ADHD, particularly when deadlines are far off. So for instance, if they are given a project that is due within a week or two, we often find that they're likely to put off doing anything related to this activity until the deadline is imminent. Other individuals would have broken the task down into more manageable units and begun doing smaller portions of the project over time, so that when the deadline arrived, they were not overwhelmed with the amount of work left to be done. But ADHD adults instead appear to wait to the 11th hour before beginning to organize and prepare for approaching deadlines. Oftentimes they have not left sufficient time left in order to deal with the oncoming task or project, and therefore often have many projects incomplete or poorly done, or they are accused of doing very shoddy work because they've left it to the last minute to do. Time management is a particular problem for ADHD adults both in school and in the workplace. They have difficulty understanding time, sensing the passage of time, organizing themselves around their subjective sense of time's passage, and in general engaging in appropriate time management strategies. For instance, they have difficulties deciding what is urgent and what is important and sorting between the two, and often find themselves engaging in work that is not necessarily important, but appears to have an imminent deadline instead. As I've said already, adults with ADHD often report a sense of restlessness, even if they are not necessarily more outwardly active than other individuals. However, a certain amount of seat fidgetiness may be characteristic of them during situations in which they have to remain seated, such as during boring meetings. These adults often say that they have to be engaged in multiple activities, and so if we look for increased physical activity, it is in the number of various projects they may have ongoing at any particular point in time, but these are projects that are often left unfinished as they skip across one uncompleted activity to another. It is often heard from the spouses or partners of individuals cohabiting with adults with ADHD that they have numerous unfinished projects lying about the house. Impulsive decision-making is a hallmark of adult ADHD, along with difficulties with persistence toward goals and resistance to distraction. They often fail to consider the consequences of their decisions before they make them, either the consequences for themselves or for other individuals. And certainly, many adults report that they are unable to work well independently of supervision. This has been also corroborated by information we have collected from the supervisors of these individuals who evaluated our adults with ADHD without knowing that these adults had any psychiatric or psychological disorders. These bosses or supervisors also reported that these adults had great difficulty working without supervision. Additional work and school concerns were as follows. Adults with ADHD report that they have trouble following directions and following through on those directions, as well as with keeping promises and commitments to others. They often change jobs more impulsively, on a whim, or if bored, or if they've had an argument or get upset with other fellow employees or a supervisor. They're likely to leave the job very impulsively without having lined up another job to go to in the meantime. This means that adults with ADHD often have more periods of unemployment between jobs than do other individuals. Indeed, in our longitudinal study of children followed to adulthood, we also found that by adulthood, these young people had more periods of homelessness as well. Adults with ADHD often report that they are late for various deadlines, projects, meetings, appointments, dates, and other activities related to both their home life, dating, marriage, and work life. By the age of 30 or later, adults with ADHD seem to be drifting more into self-employment. This is not yet a definitive conclusion about adult ADHD, but the New York longitudinal studies indicated that in their children, by the time they had reached 30 years of age or older, there was a propensity for these individuals to more and more be in self-employment. Now, this may have to do with the fact that they are having difficulties retaining jobs with other individuals, and therefore there isn't much left other than going to work for themselves. On the other hand, it's possible that self-employment offers a more forgiving niche for individuals with ADHD because they're the boss. They can determine their work schedules, they can work at their own pace, they can delay their work into later hours of the day or evening when they feel more alert and better able to concentrate. And also, the consequences for their work are near. If they don't work, they don't eat, and they can't pay their bills. This is less likely to be the case when adults work for large employers, where there is a little bit more latitude around the kind of work they do, and the consequences for that work, such as their weekly or monthly paycheck. Whatever the reason, it may be that adults with ADHD are drifting into self-employment, perhaps by niche picking, in order to find areas of life in which their ADHD is less likely to impair them. Certainly adults with ADHD have difficulties with working memory, as I have described in other courses on this website related to executive functioning. They're often forgetful in daily activities, misplace items that are important for getting tasks done. and they report having difficulties remembering what they've been told to do or what they have wanted to do, such as the goals that they had planned for that day. All of these suggest significant problems with working memory. Working memory is the ability to hold in mind information that is guiding behavior over time toward a goal. Research shows that of the two kinds of working memory, ADHD is associated with more severe impairments in nonverbal working memory than in verbal working memory. Nevertheless, both types of working memory have been shown to be impaired. These working memory difficulties also show up in problems with reading comprehension, comprehension of what they listen to, and comprehension of things that they see, such as movies or educational videos. They are less able to hold in mind the actions and information that are occurring in these media, and therefore are less able to retain information that is important in giving reports about what they have read, seen, or heard. One of the most common complaints of adults with ADHD is that they view themselves as having poor self-discipline. This refers to their difficulties with self-restraint or impulsiveness, but I think it also reflects the difficulties they have with self-organization and problem-solving, with time management, and with self-motivation. As I said in other courses on this website, ADHD in children and adults is also associated with difficulties with emotional self-regulation. Whatever reason, expect to hear from adults with ADHD that they have little willpower and view themselves as having poor self-discipline. As I've said, difficulties regulating emotion is also associated with ADHD, particularly impulsive emotion, so that they are quick to become impatient, easily frustrated, quick to anger, and often are more easily excited or aroused by situations around them that are emotionally provocative. This does not mean that they have a mood disorder, as I have argued in other courses here. Instead, it simply means that their normal emotions are expressed more impulsively. They don't restrain them as much as other individuals, and they don't moderate them or make them more socially appropriate or consistent with their goals and welfare as do other individuals. Studies of ADHD children grown up to adulthood, as well as studies of clinic-referred adults, indicate that these adults are more likely to be dismissed from employment, that is, fired from a job, than are other individuals. My own research indicates that this is more often related to their difficulties with regulating their emotions than with problems with paying attention or with impulsiveness or hyperactivity. That is to say that their difficulties inhibiting emotions often get them into trouble in the workplace, and it is this emotional dysregulation that is the area that is least forgiven around ADHD in adults by their employers. Studies that have been done by Ron Kessler as well as other individuals with regard to workplace problems show that ADHD adults are often absent from work more often than other adults. They also report being underproductive more days of the working year than do other adults. On average, 22 days per year were reported as being missed in work or being less productive at work compared to other adults. Let's have a look at some of the specific difficulties that adults with ADHD in the UMASS study reported in the workplace. Now here is a graph of the percentage of jobs that individuals had held since leaving high school on which they had experienced various problems. You can see here that adults with ADHD reported having difficulties getting along with others on more of the jobs that they had been employed in than was the case with the clinical or community groups. The ADHD adults also had had more jobs in which they had behavior problems, more jobs from which they had been fired, more jobs that they had quit over hostility with their employer or with other individuals. They also reported having quit a higher percentage of jobs simply out of boredom, as I'd mentioned earlier. And finally, they reported a higher percentage of jobs in which they had been formally disciplined by their supervisor. So it's clear that adult ADHD interferes significantly with workplace performance. Other difficulties in the workplace reported by our adults are shown here. Our adults, as well as other studies, have shown that adults with ADHD frequently have difficulties with workplace performance, more frequent use of sick days, a greater frequency of accidental injuries in the workplace, and often cost their employers more as a result of reduced or lost work performance than do other adults. So there is a tremendous economic impact of adult ADHD in the occupational setting. Let's turn now toward the area of social relationships or interpersonal concerns that were expressed by adults with ADHD in our study and in other research as well. Adults with ADHD often report difficulties in being aware of the extent of their social impairments. And even if they are aware of their social impairments, they report that there is little that they seem to be able to do about it as a result of their verbal impulsiveness and disinhibition. So even if they are aware that they are having relationship problems with others, they seem less able to do much about it, most likely because of the disinhibition associated with the disorder. They often make impulsive comments to other people, particularly offensive comments without thinking, and this can cost them dearly in their social relationships. It's no surprise that they have fewer friendships, and that the friendships they have do not last as long as what we see in other adults. When involved in conversations with others, whether loved ones or strangers, adults with ADHD often have more difficulty getting to the point of the conversation. They often show a lot of circumlocution, which is to say that they beat around the bush and engage in a lot of descriptive verbalizing, but that has very little to do with the point that they are trying to make. They often lose the point of the conversation or the goal they had in mind, and frequently report that they can't remember what it was that they were trying to explain to individuals. So they're not just more verbally talkative, they're not just more likely to interrupt others, as the DSM-4 criteria indicate. They're also having difficulties getting to the goals of their conversation quickly and efficiently. As I said earlier, adults with ADHD have more difficulties with impulsive emotion and with the self-regulation of those emotions than do other adults. Not only does this have consequences in the workplace, but as you see here, it also has substantial consequences in interpersonal relationships, especially with loved ones. They often report being more easily frustrated, more quick to respond with anger, being less patient with others, and showing higher rates of expressed emotion than do other individuals. Research shows that adults with ADHD are often poorer at judging the emotional reactions of others, and perhaps this contributes further to the difficulties they have in interpersonal relations, which is to say that they have more difficulties reading the body language of others as to when others are becoming upset with them, bored with them, or otherwise frustrated with the interaction that they're having with the adult with ADHD. These adults sometimes tell us that they were more likely to have been class clowns in school and to continue that pattern of behavior into the workplace or even into their social situations. They are more prone to silliness, to laughter, to clowning around with others, to being loud and boisterous, as well as to being risk-taking individuals or seeking out very novel activities, so that they often have a penchant for sensation-seeking. They also show a poor adherence to the promises that they make to others or to obligations they have undertaken, especially with repayment of debts. When we interview the spouses, cohabiting partners, or close friends of our adults with ADHD, which we did in the UMASS study, these individuals report that the adult with ADHD seems to be a little less mature in their social skills, seems to be more preoccupied with themselves and what they're interested in, and therefore they're accused of being more self-centered. They're not necessarily more narcissistic or vain, it's just that the topic of conversations, as well as of their interests, seems to center more on them, and that the adult with ADHD seems to be less inclined to inquire about the needs, wants, interests of other people. Continuing with the problems that adult ADHD causes in the interpersonal domain, ADHD adults are often reported to have difficulties listening to others. Instead, they talk too much, dominate conversations, are often loud in the tone or level of their conversations, usually are more emotional in those conversations, and frequently interrupt the conversations of others or interrupt what others are saying to them in order to explain their own side of things. They also interrupt the activities of others more frequently than do other people. ADHD adults report that they have difficulties engaging in leisure activities quietly. It's not clear whether this means that they are more noisy when they try to engage in these leisure activities, or that they have trouble with quiet leisure activities such as reading for pleasure. In either case, expect to see that they report this as one of their symptoms associated with their ADHD. Other people report that adults with ADHD appear to be socially sticky. That is, they don't seem to be able to pay attention as to the cues when a conversation or interaction should be ending. They seem to go on, talking about their own interests, or carrying on a conversation without regard to the reactions of others that are signaling that this conversation needs to end or the topic needs to change. As a result, people see them as socially sticky and difficult to extricate themselves from in interactions with the adult with ADHD. Many studies, including longitudinal studies of children into adulthood, indicate that they have difficulties sustaining close friendships with other people, that they have fewer close friends, that their friendships have not lasted as long as other people, and that their friendships turn over quite frequently, probably because they are burning out these relationships at a faster pace. These difficulties extend into their reports of their dating relationships with others, and we have found that they further extend into their marital relationships, where both parties to the marriage often report being more dissatisfied with their relationships than is the case in control groups of adults. Several studies indicate that both teenagers and adults with ADHD engage in a pattern of risky sexual activity. They start having sexual intercourse earlier in adolescence than do others, often at least 1 or more years earlier. They change partners more often because of a shorter duration with particular partners. They're less likely to use contraception, and as a result they're more likely to have had pregnancies or to have given birth to children during their adolescent years. We've also found this to be the case with their parents who had ADHD, where a pattern of early parenthood appears to be typical of adults with ADHD across generations. The UMASS study also found a 4-fold increase in the risk for sexually transmitted diseases in these adults. So not surprising, ADHD is associated with a pattern of risky sexual behavior, even if it is not associated with a higher incidence of sexual disorders. When we examine the lifestyles of adults with ADHD, as I've said, we often find that they have fewer ongoing current friendships, that the friendships they've had were of a shorter duration. Their parents report that the children who are now adults with ADHD are also more socially impaired. This is also true when we interview the spouses and partners of these adults. So social impairments appear to be ubiquitous in adults with ADHD. As I've said, when we look at marriages in adults with ADHD, there is a higher level of dissatisfaction. There is also a greater likelihood of divorce in these adults. And our adults also confided that a higher percentage of them had engaged in extramarital affairs outside of their committed relationships than was the case in our control groups of adults. Adults with ADHD who are parents rate themselves as experiencing a greater degree of stress in their role as parents than do other adults who don't have ADHD. When we looked at how adults with ADHD specifically were spending their leisure time, we found that they spent more time talking or texting on cell phones, watching television, playing video games, or just generally socializing. A particular point I'd like to make here is that a recent study has shown that children and teenagers with ADHD were more prone to be addicted to the internet, particularly with playing video games. It's not clear that this extends to adults with ADHD, but the foregoing pattern of leisure activities suggests that this might be a problem even in adulthood. Our adults reported spending less time engaged in reading, in self-improvement, in getting additional education as adults, and in physical exercise. As a result of these differences in leisure time activity, one would not be surprised to find that adults with ADHD, because of this less healthy lifestyle, were more prone to health-related difficulties, and might be more prone to cardiovascular disease as a consequence of this pattern of behavior if it were to extend over longer periods of time. Many studies have looked at the psychiatric difficulties, that is, the comorbid psychiatric disorders that are likely to coexist with adult ADHD. In parentheses, you see a range of the percentages with which these disorders were associated with adult ADHD across various research studies. Oppositional defiant disorder was the #1 comorbidity seen in child ADHD, and it also appears to be a common comorbidity in adults with ADHD. I believe that the rates for oppositional disorder are higher than this. The reason is that these comorbidities are based on the self-reports of these adults about their behavior. And our research shows that adults with ADHD, particularly young adults, are likely to underreport their symptoms of these externalizing disorders, at least up until 30 years of age, when their reports appear to become more consistent with that of others who know them well. So I would consider these to be sort of the lower bound estimates of the risks for these comorbidities, particularly for these externalizing disorders of conduct disorder, antisocial personality disorder, along with ODD, as I've already mentioned. One of the most common personality disorders associated with ADHD is antisocial personality disorder. Also, we found a higher frequency of borderline personality disorder, and of passive aggressiveness as well. Yet all of these personality disorders appeared to be related to whether or not the adult had developed conduct disorder by age 15. In adults who had not developed conduct disorder, we did not find a higher incidence of personality disorders. That is to say that personality disorders appear to be tracking with comorbid conduct disorder and are not generally associated with ADHD alone. But ADHD is associated with a higher risk for substance use disorders. At least 1 in 4 ADHD children will develop a substance use disorder by adolescence, and the figure is even higher when we look at clinic-referred adults with ADHD. As you see here, the substances most likely to be abused by these adults are alcohol, marijuana, and nicotine, which is not shown on this slide. Indeed, there appears to be a special affinity between adult ADHD and nicotine dependence and abuse. Adults with ADHD are likely to start smoking earlier, increase their rate of smoking more quickly, and are likely to be smoking more cigarettes per day than are other smokers as well. Perhaps this is a form of self-medication, because we know that nicotine produces positive benefits for improving ADHD symptoms. The risk for alcohol dependence, however, does not appear to be a form of self-medication that improves symptoms, because alcohol is known to worsen symptoms of inhibition. Perhaps this is because people with ADHD may be drinking alcohol in order to forget their difficulties or the failures that they've had in life. It's also known that alcohol results in a constriction of one's perception of time, or a telescoping of one's perception into the now, so that individuals are likely to drink in order to forget their past difficulties or their future problems. Whatever the case, ADHD is associated with a greater frequency of substance use and abuse. We found that comorbid conduct disorder was the greatest predictor of the likelihood that adults with ADHD would be abusing hard drugs, such as crack cocaine, methamphetamine, or heroin. It was also associated with a greater propensity for abusing prescription drugs illegally. So, ADHD predisposes to alcohol, marijuana, and nicotine use, but ADHD with conduct disorder predisposes to harder drug use. Some studies have also shown a higher frequency of seasonal affective disorder being associated with ADHD. You can see the rate here. Nevertheless, the majority of adults with ADHD do not have this difficulty. Dysthymia is especially common in ADHD adults. This milder form of depression was found in our particular study to occur in upwards of 30 to 37% of the clinic-referred adults in that study. Major depression has been found both in children and in adults to be a particular comorbid disorder at which adults are at high risk. On average, about 35% of adults with ADHD will develop major depression at some time in their life. Anxiety disorders are also more likely to occur with adult ADHD. In fact, we found that the longer ADHD had persisted into adulthood in our follow-up study of children, the greater was the likelihood that one or more anxiety disorders had developed by at least 30 years of age. Indeed, more than a third of our young people had developed anxiety disorders if their ADHD had persisted to age 30. Now, while clinicians seem to believe that ADHD in adults is associated with a greater frequency of obsessive-compulsive disorder, no studies have been able to show this to be the case. All research shows that ADHD adults have about the same frequency of OCD as is found in the general population, a range of about 1 to 4%. However, the inverse may be what drives this perception. That is to say that if adults have OCD, they do have a higher frequency of ADHD. This is also true with the related disorder of Tourette's syndrome. In other words, there may be a one-way comorbidity evident here. Adults who have either Tourette's or OCD are more likely to have ADHD, even if adults with ADHD are no more likely to have these disorders than the general population. As I said in my discussion of comorbidity in ADHD on this website, ADHD may be associated with bipolar disorder, but here too we see evidence of a one-way relationship. That is to say, ADHD does not appear to be associated with an increased likelihood of developing bipolar disorder. Our study indicates that only about 2 to 3% of children with ADHD grown up developed bipolar disorder. This has also been found to be the case in other studies. However, if we study people who have developed bipolar disorder, in adulthood, we find that these adults may be more likely to have ADHD. About 15 to 20% of adults with adult-onset bipolar disorder had developed ADHD as a comorbidity. Now, as I said in my discussion of childhood ADHD, if the onset of bipolar disorder occurs in adolescence, then the risk for comorbid ADHD is doubled. That is to say, 40 to 50% of adolescents with bipolar disorder had ADHD. And if bipolar disorder occurs in childhood, that risk nearly doubles again. That is to say that 80 to 97% of children with childhood onset bipolar disorder had developed ADHD as well. So clearly the comorbidity of bipolar disorder with ADHD is driven by the age of onset. The earlier the onset of bipolar disorder, the greater is the likelihood that ADHD is associated with it. Now, children with ADHD have a high propensity for a comorbidity with a learning disability. On average, about 50% of those children have developed at least one or more specific learning disorders, such as problems with reading, math, spelling, or language. We see here that in clinic-referred adults with ADHD, the risk can be as high as 35%. Clinicians will need to take all of these disorders into consideration in planning their approach to assessing adults with ADHD, and that is because at least 80% of adults are likely to have at least one of the disorders you've seen on the last two slides, and at least 50% of adults are likely to have at least two of these disorders. So comorbidity with a psychiatric or learning disability is very common in adults with ADHD. Indeed, we could say that it is very typical. It is rare to see an adult with ADHD who only has ADHD. In our study, only 16% of the adults seen at our clinic only had ADHD as their disorder. As I've already indicated, driving is a particular area of impairment for adults with ADHD. Our studies of these adults indicate that they operate the vehicle somewhat differently and in a more impaired fashion, having difficulties keeping the vehicle on the roadway, probably because of inattentiveness, having slower reaction times while braking to critical events, again most likely due to their inattention. They're also described by themselves, by other people, and by driving instructors that we've hired to take them out on standardized courses in our geographic region as having less safe driving habits while operating a motor vehicle. They're more likely to drive as teenagers before they're licensed to drive, which is to say they take their parents' car and go out joyriding even before they get a driver's license. As I've said earlier, ADHD in adults predisposes to auto accidents. You can see here that ADHD adults have 2 to 3 times the rate of accidents. They're likely to have multiple accidents during their driving career, as you see here, and they're likely to have many more speeding citations. Indeed, 4 to 5 times more speeding citations on their driving record than are adults in our control groups. The crashes they have are significantly worse. not only as measured in dollar damages, as you see here, but also as measured by the percentage of individuals likely to have experienced a bodily injury in the crash. As a result of this pattern of impaired driving, ADHD adults are 3 times more likely to have their licenses suspended or revoked during the first 10 years of their driving history. Another study that we conducted indicated that adults with ADHD were more impaired by alcohol, even at low doses, in their driving performance than were adults in our control groups. This suggests that adults with ADHD should be cautioned against using alcohol, any amounts of alcohol, while driving. After all, they're already driving impaired as if they were drunk, even when they're not drinking. And therefore, adding alcohol into this pattern of impairment appears to be associated with a greater risk of further impairments in their driving. Here you can see graphically the percentage of adults with ADHD that had experienced these various driving outcomes in the UMASS study. Remember, this is the study that is comparing 3 groups of adults that you see over here on the right. You can see here that a greater percentage of our adults had had their license suspended by the time they participated in this study. They had higher, or a greater percentage of our adults had also experienced at least one crash. The reason that these differences are not very striking is because many individuals have at least one auto accident. Indeed, 1 to 2 accidents is the norm in the driving history of even normal adults. I'll show you on the next slide the frequency for these outcomes, and there you'll see that adults with ADHD have more accidents than other individuals do. These adults were more likely to be held at fault in these crashes, were more likely to have had at least 1 or more speeding tickets, to have been cited for reckless driving, and to have any citations on their official DMV record. Now on this graph you see the mean frequency of occurrence. And this proves the point I made earlier, that adults with ADHD are especially likely to be accumulating frequent tickets for speeding with a motor vehicle. They also have more total citations on their driving record than do other adults. This pattern of results suggests that adults with ADHD are going to need specific interventions for dealing with their driving problems, and not just for their difficulties with educational and workplace problems. Indeed, I am of the opinion that adults with ADHD should be encouraged to be on medication at all times while they're driving, because this is a particular domain of major life activities that can be life-threatening for these adults or for other individuals. As I mentioned earlier, ADHD adults report a higher incidence of having been involved in antisocial activities. This graph shows the percentage of adults in each of our groups that had engaged in various antisocial activities at least once during their earlier years or currently. You can see here that there was a greater incidence of shoplifting, stealing money, breaking and entering, and a particularly higher incidence for assaulting others, usually with reactive aggression, of having been arrested. As you can see here, nearly 40% of our adults had been arrested at least once by the police. And you can see here that at least 1 in 4 adults had spent some time being incarcerated. So as others have found, both ADHD children and adults have a pattern of a greater frequency of antisocial activities across their lifetime than do other individuals. Here you see that this pattern extends back into the childhood years. So when interviewing adults with ADHD about their childhood, expect to see that more such adults report a history of antisocial activities as children and not just as adults. You can see here once again that the ADHD adults are reporting a greater likelihood of having engaged in all of these antisocial activities as compared to our 2 control groups that you see here. So, antisocial behavior is not just characteristic of current functioning, but of their retrospective childhood activities as well. As I mentioned, adults with ADHD report a higher frequency of drug use of all substances than do control adults. And you can see here the percentage of adults with ADHD that were using tobacco, or that had ever used cigarettes, that were using alcohol, Notice here that the percentage that were using alcohol was slightly higher in our clinical control group. Perhaps this is because more adults with anxiety disorders were in this group, and adults with anxiety disorders often report using alcohol as a means of coping with their anxiety. Nevertheless, if we were to examine the frequency with which these people were drinking, the adults with ADHD would report a higher frequency of consuming alcohol, even if a smaller percentage of them are doing so. Here you see that more adults with ADHD are consuming marijuana, or have used cocaine, LSD, or other drugs such as prescription drugs. I've already mentioned that adult ADHD shows a particular affinity for nicotine use, particularly cigarette smoking. We are not the only ones to have found this relationship. Here are the results of a study conducted by Pomerleau using 71 adults with ADHD as compared to a general population sample of adults. You can see here that adults with ADHD, which is the upper bar, are much more likely to be current smokers than is the general population. This is true both for men and women. When we examine the likelihood that an individual is going to be able to quit smoking, we see that adults with ADHD are far less likely to have attempted to quit smoking than are adults in the general population. Other studies, more recently, have shown that ADHD adults have particular problems in smoking cessation programs and are less likely to be successful in such programs, and are more likely to remit even if they are successful, to recidivate, which is to return to their smoking, than are normal adults in the general population. Now, it's not just smoking that is associated with ADHD. Our study has found that adults with ADHD have a higher likelihood of having health concerns in all areas of health maintenance than is the case in general population samples. As you can see here in the UMASS study, adults with ADHD, just like children with ADHD, have a higher likelihood of experiencing sleeping difficulties. We've already discussed the social relationship problems that they're likely to be having. Also more likely to be having difficulties with family conflicts. A greater propensity for tobacco and drug use is also seen in adults with ADHD. More of our ADHD adults reported having general medical difficulties as well. And as we've already discussed in the area of driving, adults with ADHD reported on our health and lifestyle interview having difficulties in this domain. Notice that both our ADHD and our clinical control group of adults both reported having difficulties in the workplace, and a significantly higher percentage of them were having such difficulties than you see in the general control group. But as I've already mentioned in my other discussion or my other courses on adult ADHD here, both ADHD in children and in adults is associated with difficulties with emotional impulsiveness and emotion regulation, and that is evident in this interview about health concerns, where they report a higher prevalence having emotional difficulties in their lives. So overall, ADHD is associated with more health concerns than is seen in other disorders or in the general population. Now, in both our Milwaukee study of ADHD children grown up and in our UMASS studies, we paid particular attention to various health-related problems in our interviews. We also did physical exams on the individuals in the Milwaukee longitudinal study. We found that ADHD adults had a higher frequency of having had accidental injuries in adulthood. This is very consistent with the literature on child ADHD that finds a similar relationship. Adults with ADHD reported having been hospitalized for non-surgical interventions than was the case in our control group. It's not clear what these hospitalizations were necessarily for, because we ruled out hospitalizations for psychiatric disorders in computing these results. Adults with ADHD utilize the emergency rooms more than do other adults. This may have to do with the fact that they have more accidental injuries, both in the workplace and at home. But it may also have to do with the fact that they have lower socioeconomic status and may have jobs that are less likely to be providing them with insurance benefits. Therefore, if they wish to get medical care, the only portal for access to that care may well be the emergency room. And as you see here, adults with ADHD also have more driving accidents and injuries associated with those accidents. Several studies have found that ADHD in adulthood is associated with more medical difficulties and more dental health problems. As I've already mentioned, adults with ADHD take more sick days off of work. They also have more unexcused absences, are more likely to file for workmen's compensation claims, and are more likely to have more days off work due to these claims for workmen's compensation than do adults without ADHD. As I reported earlier, adult ADHD is associated with more sleeping difficulties, so it's no surprise that they report a greater likelihood of falling asleep at work, of falling asleep later into the evening, of waking up more frequently, of being more tired during the daytime, and other sleep-related difficulties. Eating disorders particularly goes with ADHD in adult females. On average, about 1 in 6 adults with ADHD who are women report having developed some eating disorder, particularly bulimia, as you can see here. So eating disorders have been found in studies to be 3.5 times more likely to be associated with ADHD in females by adolescents, and it particularly is associated with the impulsive eating disorder of bulimia. Studies by Makami have shown that the development of eating disorders in women appears to be linked to the impulsive dimension of their ADHD symptoms, but it's also associated with their history of peer rejection and also with harsh parenting. Makami also finds that if these women had concurrent major depressive disorder, or other internalizing disorders like anxiety disorders, or even externalizing disorders like ODD and conduct disorder, that all of these factors were likely to increase the likelihood that the woman would develop an eating disorder. In addition to those difficulties, our studies find that on average, ADHD adults report a higher frequency of vague medical complaints, and so it's no surprise that they have a higher incidence of qualifying for somatization disorders. Our study at UMASS found that these difficulties were associated with levels of anxiety as measured on the SCL-90. Adults who had higher levels of anxiety were, no surprise, much more likely to be reporting medical complaints of vague bodily complaints. As I've indicated, these adults are more likely to smoke and to use alcohol, and to do so more frequently than do other adults. This pattern of behavior is going to predispose them, most likely, to coronary heart disease, as well as to a higher risk of cancer later in life. And indeed, that was the case. Our UMass study, which did complete physical exams on the children at adulthood, found that individuals with ADHD, especially if their ADHD persisted into adulthood, were likely to be overweight, were more likely to qualify as being obese, particularly if they were female. They also had lower levels of good cholesterol, or HDLs, and higher levels of bad cholesterol. As a result, their total their total HDL to LDL ratio was more adversely affected. That is to say, it placed them in the higher risk range for having coronary heart disease. We also used the Framingham Heart Study, as well as other ways of determining risk for atherosclerosis and risk for future coronary heart disease, and found that the children in this study, by age 27 to 30, were already accumulating a higher likelihood of coronary heart disease. That is to say, they had a higher frequency of these risk points than did individuals in the control group. So even at a very young age, ADHD is associated with a greater risk for coronary heart disease over the next 5 to 10 years. This may forebode, or foretell, that is, a greater likelihood of developing cancer in later life. This is unclear because at the present time no studies have documented a higher incidence of cancer, but that's because individuals participating in these studies are still in their early to mid-adult years, and the risk for cancer accumulates over time. It's likely that if these adults were followed into later life, and if this pattern of behavior had remained unchanged, that there would be a greater frequency of cancers in these individuals. Some evidence is already accumulating that ADHD may shorten the life expectancy of these adults. We know that children with ADHD are 3 times more likely to die by age 46 than are other individuals. We also know from the Friedman studies that individuals who are especially impulsive are likely to have a life expectancy that is 7 to 8 years shorter than individuals who are not characterized as impulsive or lacking in conscientiousness. We know that ADHD is associated with greater impulsiveness and lower levels of the personality dimension known as conscientiousness, and therefore we would expect that they might have a shorter life expectancy if their ADHD remains untreated. We interviewed our adults with ADHD about the means with which they were managing their money, that is to say, about specific money management difficulties. And while I can't show you all of the results here, you can see that in the domains represented in this graph, a higher percentage of adults with ADHD were reporting having had difficulties in these and other areas than it did adults in both of our control groups. So ADHD is associated with financial difficulties, and this leads them to have lower credit scores, to be more likely to have their utilities turned off for non-payment, to be more likely to have their cars repossessed than is the case with other adults. ADHD is a particularly inherited disorder. That is, it is highly genetically influenced. For more information on the etiologies of ADHD, please take my course on this website on that topic. Now, if ADHD is genetically predisposed, we should not be surprised to see that the offspring of ADHD adults have a higher frequency of having ADHD. We evaluated the children of the ADHD adults in the UMASS study, and you can see here that we found precisely that outcome. The children of ADHD adults were more likely to be classified as impaired in their inattention, in their hyperactive and impulsive symptoms, and to qualify for the combined type of ADHD. Overall, at least 40% of the children of ADHD adults qualified as having one or more types of ADHD. This is consistent with other studies that show that between 40 and 54% of the children of ADHD adults are likely to be diagnosed with ADHD themselves. Now, in my research, I have been able to compare children with ADHD growing up to adults with ADHD who self-refer to adult ADHD clinics. We were able to compare them on the same measures of impairment, and what we found is while the disorder is very similar, if not identical, between these two populations of individuals, their risks are not necessarily the same. We found a greater correspondence between self and other reports of symptoms and impairments in the adults who self-referred as compared to the children growing up with ADHD. All of this is to say that children growing up with ADHD underreport their symptoms relative to other people who know them well. This is less likely to be the case in adults who self-refer. We found that adults who referred themselves to clinics had higher levels of education, higher incomes, a higher socioeconomic status, lower rates of learning disabilities, and higher levels of intelligence than did the children who grew up with ADHD and whose ADHD persisted to age 27 to 30. So adults who self-refer are a higher functioning, less impaired group of individuals than are children with ADHD followed to adulthood. We found that our adults with ADHD who self-referred had less antisocial behavior, less drug use, and reported fewer arrests and less likelihood of having been jailed for those arrests than was the case with the children who grew up with ADHD. Now, this doesn't mean that adults who self-refer don't experience these outcomes. They do, and they experience them at a higher frequency than do other adults. But it is to say that children growing up with ADHD are even more impaired by adulthood than are adults who are self-referring at this time to clinics. Interestingly, adults who self-referred were more likely to have comorbid anxiety disorders and depression than were the children who grew up with ADHD. They too were more likely to have these disorders, but the self-referred adults were even more likely than the children growing up with ADHD to have those disorders. Self-referred adults had a lower frequency of personality disorders than did the children with ADHD growing up. Interestingly, both groups of individuals showed similar patterns of impairment on neuropsychological test profiles, and both groups showed similar and pervasive patterns of executive functioning deficits on rating scales of executive functioning. We also found that both of these groups of adults were equally impaired in other domains of major life activities, such as in risky sexual activity, teenage pregnancies, dating and marital difficulties, problems with child rearing, difficulties with managing their money, driving impairments, and in concerns about their health. So in general, ADHD in self-referred adults is very similar to, if not identical, to ADHD as seen in children who grow up with ADHD and whose ADHD persists to adulthood. And while there may be slight differences in some areas of impairment and in some areas of comorbidity, the disorders are the same. In conclusion, I hope that you have found that this course has shown you that ADHD is a relatively common disorder in adults. Indeed, about 5% of adults have ADHD. That ADHD is associated with impairment in virtually all major life activities studied to date, from education to occupation to sexual activities to comorbid psychiatric disorders to driving to drug use, antisocial activities, and even to the likelihood of disorders in the offspring of these individuals. Adult ADHD appears to be more impairing than are other outpatient disorders, such as anxiety disorders and depression. We know this because ADHD in adults results in more severe impairments in each area examined, and impairment in more domains of major life activities than adults who do not have ADHD, but who have other clinical disorders, such as anxiety, depression, learning disabilities, or even relationship problems. We also found in this survey that adults with ADHD have more medical disorders, which indicates that ADHD in adulthood is a public health disorder, not just a mental health disorder. All of this is to say that when clinicians see adults with ADHD, they can expect to hear about these difficulties with impairments in the histories of these adults and should look for them. But it is also to say that clinicians are going to need to be prepared to deal with these various areas of impairment, and not just with managing ADHD symptoms, if they hope to improve the effectiveness and the life course of adults with ADHD. Thank you for taking this course on the impairments of adults with ADHD. I invite you to take the other two courses associated with adult ADHD on this website. Part 1 deals with the nature and diagnosis of ADHD in adults, and Part 3 deals with the assessment of adult ADHD, and especially with its treatment. Please visit my publisher's website at guilford.com to learn more about other products I have about ADHD in the marketplace, particularly my 3 new rating scales published in 2011 for assessing adults with ADHD, such as using the Adult ADHD Rating Scale, for assessing executive function deficits in adults, and for assessing psychosocial impairment or functional impairment in clinic-referred adults. Thank you again for taking this course. Goodbye.